Tried to find papers of anybody that studied this to get a more scientific view. And the truth is that only psychologists and pretty much anyone in that field was researching it, which didn't really apply to veterinary medicine. Nobody really put it in this kind of context. So I just picked a bunch of scenarios that I was put in over 15 years of being a technician, between having problems with other technicians that aren't always so subordinate and or unruly doctors that aren't so friendly. I picked a bunch of stuff just to try to use examples to exemplify the point. Am I not allowed? I tried to just exemplify the point. So I picked particular scenarios that created kind of a better picture. So by law, what separates us is simply that these are the only 4 things a technician's not allowed to do. That's it. It's just performing surgery, diagnosing, prescribing drugs, and giving a first rabies vaccine. Other than that, we're really not any different. Especially when you talk about a technician that's been in the field longer than we've been alive. And you'll run into them, and they're going to teach you more than anybody. So, for example, one of them is our head technician at the teaching hospital we have here. Her name's Michaela Witcher. She was a professor of mine about 12 years ago, and she is unbelievable. Food for thought. Performing surgery is also defined by the facility that you're in, not just the state law. For example, in Ohio, surgery is defined as entering a body cavity, which then means a technician can remove teeth and do those sorts of things. Where in New Jersey, it's defined by not removing any part of the body, which means you're not even allowed to trim nails. You're technically removing a part of the body. So, okay, take this with a grain of salt. And obviously the education level. Some techs are very educated, some are not so educated, but I don't think I have to tell you about our education. So we'll go from there. These 2 I actually brought home from a hospital one day, and they spent the weekend with me. They got to do a bunch of rat bait, and they ended up becoming foster feathers. But the point is that these things are always good to have. These are simple, unspoken rules that allow individuals to jive. And creating a better atmosphere means higher productivities. Higher productivities improve relationships. It's kind of a 360-degree turnaround. But I figured I'd throw them up just for what you're kind of looking for in each other. And the patient's intolerance by far is the biggest one. Everybody needs room to grow. We're all going to make mistakes. And hopping on people for making mistakes is not really okay. And that's one big thing doctors harp on, because a technician can cost the doctor their license. So, I mean, worst case scenario, but it happens. I've seen it happen. It's not good. All right, so one big thing to avoid is the I'm the doctor, okay? We're all in this together. Doctors are in need of their technicians as much as the technician is in need of their doctor. So an understanding has to be met. A common ground has to be established. And when you get out into the workforce, and I don't have experience obviously from the doctor's side, we're all here for that, but I spent some time in a veterinary teaching hospital for a few years in an anesthesia department. And we would take raw students on rotations, and we would take 4th year students, and we would, technically they're trained by their clinician, but I would spend 8 hours a day with them, where the clinician would spend 1 hour a day with them. So technically we were kind of training each other. I was getting the book work from them, and they're getting the hands-on skills from me. And this agreement has to be made that we're not going to know everything. And the easier you made it for each other, the more productive you could be, the more patients you could see per day, the more you can learn per day, the more you're exposed to per day. And over time, that means more money for the hospital, which obviously means you're going to get higher pays and see more patients. But business can't stand without money, whether you want to practice medicine or not. So you got to make the money in order to continue to practice. And if you approach it from that point of view, it sucks to say the dollar is what means everything, but we're talking about America here, so it means everything. It's an all-encompassing idea. And the idea that you can base everything on the relationship is a big deal. It creates a comfortable environment. So I'll tell you a story about Tank in a second. But what this comes from is, okay, so this is a 10-week-old French bulldog that arrived on our doorstep in comatose. She ended up being a parvo-positive puppy and babesia positive. She was adopted from Aruba. So a inexperienced technician was trying to do their TPR, physical exam. This dog is lateral, flat out. Doctor comes over, and this is one of your not so nice doctors. It's not that she's not so nice, she has a lot of insecurity issues. So the second the technician tries to ask a question, the doctor feels combated on what they think or what they know, as opposed to the tech trying to learn something. Okay, so communication skills and providing an environment for one another. So this creates this big animosity between the two of them. And a long story short, what the first point is, what you say to tech A has an effect on tech B and C. So anybody on the floor, anybody in the room will remember how you were treating their friend, their coworker. Tech staffs are one unit. They're difficult to deal with. They're a whole group. You can't ever single anybody out. So, all right, so the story goes, the inexperienced technicians were standing on the table. They're trying to pump this dog full blood. PCV's 9 when she hit the door. So they're putting blood in the door. This technician was not supposed to be in this position, but we were shorthanded. The doctor's freaking out because she doesn't have help. And another experienced technician happens to walk in early for their shift. The doctor turns around and says, well, thank God you're here. Well, you just made that technician feel great. But what you just said to the technician that's holding your dog is, you suck. You can't cut it. You're not going to be able to help me. And now the technician behind you who's treating your patients in ICU isn't going to feel so great about that either the next time they have to work with you. It makes them wonder, what are you really thinking about me? So you got to pick and choose your words wisely. Even though you tried to give a compliment to one individual, you crucified 2 others. So it gets kind of rough. But the environment itself is what creates the ability to put it all together. So you create an uncomfortable environment, you create distractions. Distractions mean mistakes. Mistakes can be pretty detrimental and result in things really bad like death. Okay, she ended up surviving, and now she lives with one of the doctors. But she ended up with 3 blood transfusions, and by the time she left, 12 days later, I think her PCV was 26. Another foster fail. So this is actually going to be a couple minute slide. So training is a big deal. A lot of, to reference the first lecture from today, so a lot of mental health in veterinary medicine. A lot of technicians I found over years, as I tried to build staffs and learned, instead of looking for skills in one another, I started looking for personality traits. I wanted things I couldn't teach. I can take somebody, or any technician that has an understanding or has a training, can take an individual and teach you to put in catheters. They can teach you to put in central lines. They can teach you to run anesthesia. They can teach you to be friendly to a client and fake it the whole way through. You know, your Cambridge business we do here. You can fake that empathy if you don't have it. I'm not very empathetic and I have to fake it. But sometimes I'm a little too honest. But it's true. You really have to do it. And that goes for working next to somebody as well. I'm not saying be fake, but I'm saying create an environment that's understanding and room to grow. This implies training. You can bring somebody in, and just because they don't know how to run a PCV and you're in the middle of an emergency and need to know it, doesn't mean that they're a bad technician. It just means they haven't learned. So you got to spend the time to train. Internal CEs I found to be quite beneficial, not just so much in training, but in allowing you to spend time together off the floor to get to know each other as human beings, as opposed to just, you're my tech, you're my doctor, you're my boss, you're a kennel cat, pick up that broom. No. It's not fair. It's not right. And it really separates staffs, and that's when your drama starts. And for anybody that works in a clinic, I don't think I have to touch on how much drama goes on in a clinic, but it all goes back to an experience where a lot of individuals that I've come across, that whether they were skilled or not, they're not very happy people. Technicians aren't traditionally happy people. They're not. You have the lifers that have been doing this 25 years that are just over it and don't know how to do anything else. But they're really good, they're just miserable. And they don't treat other people very nicely, especially new people. And that whole training thing goes right out the window, because their ability to be better or do more is what gives them validity to their job. Does that make sense? Yeah. So internal CEs give them the ability to teach so they feel valid, thus then you spread their knowledge. So everybody's sharing what they know and what they're learning. And learning together. This is huge. I had a doctor one time that I spent 7 months with 5 days a week, and we literally would not speak to one another unless there was a patient between us on the table. Literally, not even a good morning when we passed each other, which I didn't really mind. We didn't like each other very much, but we had a mutual respect for one another. We had an understanding that we could do our jobs. We didn't have to like each other. And when we established that, the entire floor of the hospital sort of settled down. There was no more, I don't want to say no more drama because it's impossible, but less of a problem, less of a ripple effect across the whole staff. It really helped. And we always have as much to teach as we can learn from one another. I don't care how good you are, I don't care how long you've been in the field. I've had people I've been training that on their 3rd day and they're 15 years old and I'm almost twice their age or over twice their age, and they'll teach me something new every time. Or a new way to do something, a new way to learn something, a new way to look something up. It's useful. So no matter what side of the fence you're on, always be open to the other person's opinion, no matter how ridiculous it may sound at the time. Because I got myself burned doing that a couple of times, really hard, and I earned it. The long and short of it is that having a technician that knows what they're doing is extremely beneficial. Having a technician that doesn't know what they're doing, but knows they don't know what they're doing, is also beneficial. There's a saying amongst veterinarians that I hear all the time whenever I pick up a new employee or something like that. There's nothing more dangerous than a technician that thinks they know what they're doing. That's when bad things happen. So never be afraid to say, I don't know. Never. No matter who you're talking to. I know it's terrible when a professor calls you out and you're like, I don't have a clue what that is. You know, or what's wrong with that patient. But the 7 people to your left don't either. So it's normal, it's okay. The second you start trying to make it look like you know everything is the second you're going to get cut off the knees, and that I'm the doctor is going to come out from the person on the other side of the table. It's really about minding your own P's&Q's. It's really what it comes down to. How you treat one person has an effect on every single person that can see you or hear you. And establishing a common ground with your client as well as your coworkers is really no different. I don't want to say treat your coworkers like you treat your clients, but it helps, especially if you're as opinionated as I am. So you really got to mind what you say. I've got myself bit a lot. And this is actually how I learned a lot of this. I screwed a lot of it up. And I've had some employees hate me, and some of them are still my best friends. But it's a determination of what you want from yourself. And the more pleasant you can be with others, the more productive you can be as a team. The better the team runs, the better the hospital performs, the larger the hospital gets, the more patients you get to see, the more you learn. It's pretty much where it all comes down to. And when your doctor flips out on you, or should I say your technician flips out on you or tries to challenge you, don't go after them. Take what they have to say with a grain of salt, especially those that have been out in the field. You'll learn a ton. It'll be extremely beneficial. So this is Tink on day 3. He actually swallowed some of that toy. That's why he got additional catheter for that surgery, which is pulled in the other leg because he's tried to eat it. But is that clear about anything? Any questions? Are we okay? Yeah? Yep. Well, thanks for having me.